Welcome to Science Hub. Today, we're diving into a topic that concerns us all: the hidden dangers lurking in everyday chemicals and their impact on our liver health. A recent study has spotlighted a common industrial compound, tetrachloroethylene, and its potential to increase the risk of liver damage and cirrhosis. Tetrachloroethylene is a colorless chemical widely used for degreasing in various industrial and household settings, most notably in dry cleaning processes. Its ability to evaporate easily means it can be inhaled, posing a risk of environmental contamination. This compound is not just limited to industrial use, it can be found in household items like adhesives, stain removers, and stainless steel polishes. Alarmingly, when it leaks into the soil, it can seep into groundwater, polluting drinking water sources. International agencies have classified tetrachloroethylene as a potential carcinogen, previously linking it to cancers such as bladder cancer, multiple myeloma, and non-Hodgkin's lymphoma. The latest findings now connect this chemical to liver cirrhosis, underscoring the urgent need for greater public awareness of its dangers. Research shows that exposure to tetrachloroethylene can triple the risk of developing liver cirrhosis, with a clear dose-response relationship, meaning the risk increases with higher exposure levels. Interestingly, individuals with higher incomes might face greater exposure levels, possibly due to their frequent use of dry cleaning services. This highlights a socioeconomic disparity in the distribution of toxic exposure. Moreover, workers in dry cleaning facilities are at heightened risk due to their constant and direct exposure to this compound. This calls for enhanced safety standards in the workplace to protect these individuals. The study emphasizes the critical importance of educating both the public and the medical community about the risks associated with tetrachloroethylene exposure. Early detection of liver cirrhosis in those exposed can significantly improve treatment outcomes and facilitate quicker liver function recovery. Researchers suggest that tetrachloroethylene is just one of many environmental toxins posing a threat to liver health, opening avenues for further study into the impacts of other chemicals. In conclusion, the chemicals we encounter in our daily lives, like tetrachloroethylene, could have serious repercussions on liver health. It's vital for individuals and society to understand the importance of reducing exposure through stricter environmental policies and increased public awareness. Early screening for those at risk could be crucial in improving health outcomes. Thanks for watching. If you enjoyed this video and want to learn more about the world of science, don't forget to subscribe to Science Hub.